Hey, what's up, guys? I'm David DeMuzio.
I'm Dr. Dan McGrath.
This is Hair Loss Hope, and today we're going to be talking about FUE versus FUT. Now, we've done a few of these videos in the past, but I thought it was time for an update. What's been really interesting is back when we did a couple FUE versus FUT videos, and we talked about some of the benefits of FUT. Boy, did I get a lot of pushback on that. I mean, people were practically yelling through the screen in the YouTube comments about how wrong I was, about how FUT was just this horrific, barbaric procedure. Why would anyone do that? And things have started to change, and it's been kind of cool to see that pendulum swing just a little bit. And other YouTubers, many of whom, like my friend, Matt Dominance or my friend Rolandus, they both had FUE procedures, but they're both doing tons of research. And Matt's been, had his first hair transplant, I don't know, 5-6 years ago. So he's had time under his belt to start really kind of noticing that FUT sometimes does have some real benefits and sometimes might even be the better procedure for you to do. So that's been really cool. I love seeing so much education. So today I wanted to talk to Dr. McGrath because he does about 50% FUE cases and about 50% FUT. So he's really right in the middle of that line and doesn't have a dog in the fight, whether it's FUT or FUE. He just really wants to do whatever is going to be better suited to his patient to give them the best result. What are, a couple of things about FUT that you find beneficial versus FUE? And what are the things about FUE that you find beneficial and the things with patients that you would sort of maybe push them one way or the other to get the best result?
FUE is a wonderful procedure in the right hands, and FUT is also an excellent procedure with a surgeon that knows what they're doing. And this is my little mantra: there's no such thing as minor surgery, only minor surgeons. The real point to take home is that not everybody is a perfect candidate for one or the other. Well, let's say we have a young man that comes in that has relatively nice donor hair, but it's fine and it's thin. And he wants to do as many grafts as he can, maybe 2,500, 3,000 grafts, but his hair density is only really good right in the central portion of his scalp, and the rest of it's kind of fine and thin. Well, sorry, but that's not a good FUE candidate. But it's a perfect candidate for an FUT, where you've got maybe a fair-skinned guy, you can get a reasonable size strip, you can do a nice closure, and then the other most obvious thing, which is the biggest reason most of them are so afraid of doing an FUT, is if they do get any type of scarring or any problems with it later, it's easy to fix. We can always come back and do a small FUE and fill in the scar. So the point is, from the very beginning, the big push against the idea of FUT was, oh, I'm going to have this horrible scar. But that's a false narrative.
Yeah.
That doesn't happen, across the board. And I try to explain to the patients that really what we're trying to do is we're trying to give you the best cosmetic result. And I've often said the success or failure of any hair transplant procedure is going to be largely predicated on the quality of the donor hair. So if you've got somebody that's got, super thick, dense hair everywhere, and they always want to wear it clippered short, and they want to do a 1,500, 2,000 graft, hairline restoration, that's great. That's a great candidate for FUE, no problem. However, that same patient that maybe wants to do 3,000 grafts, yeah, it can be done. But then they have to be aware that don't let anybody try to tell you that there's such a thing as a scarless procedure. So even with those patients with thick, strong, durable hair, maybe you can get that extra amount. And yes, you can have a beautiful result. We've done a number of them. But they still have to be aware that they got to keep a little bit of length to camouflage so you don't see any of the small little white dots.
Once you're doing, enough grafts, once you're taking enough grafts out of the back of somebody's head, there is going to be a certain amount of space. There's hairs that are disappearing. And one of my friends, Josh, has one of the best FUE result I've ever seen in my life. And he actually has just started going back and is actually getting body hair transplants from his cheek and neck. into his FUE scars.
Yeah.
So he's having to go through exactly the same thing that a FUT patient would have to go through too, getting some. So he's also having to now fill in his scars because he realized, hey, I'm clipping my hair short. Now I have this kind of a moth-eaten sort of look. I have this great result on top, but it's all a math thing. When you're taking it from one place and putting it to another, it's it all has to sort of balance out.
There are a handful of excellent surgeons in this country, and we could go through a few names, but that's not what's important. There's a handful of them who do nothing but FUE, and that's perfectly fine because I know these individuals personally, and I also know that they're not going to do a procedure on somebody if they come in and their hair just isn't strong enough. They're not just going to do an FUE procedure for the sake of doing it.
Yep.
I know these guys, and they're not going to do that. Versus a lot of the clinics that are out there that, I'm sorry to put it this way, but they're not hair transplant surgeons, and they never found a head that they didn't like, and all they do is FUE, and guess what? Not for nothing, I'm the one that's fixing it.
Yeah.
99% of the time, myself or one of my colleagues are correcting it because it comes out too thin, too fine, they don't know how to pack it densely, et cetera, et cetera. The point to take home is it's not like there's one that's necessarily better than the other. I think you have to assess each individual patient, and there are times when, yes, FUE would be a far superior for that patient's circumstances, et cetera. But there's other times when an FUT is a far better choice. And the only reason that I've seen over the past 2 to 5 years that patients seem to have an aversion towards the FUT is the fear of the scar. Mm-hmm. Well, again, there's no such thing as minor surgery, only minor surgeons, and maybe there are some guys whose scars aren't as good as they could be. But even if a patient comes to me and they have a bad scar and they want FUE, we can sort of do double duty, where we can fill in the scar, harvest other tissue, continue to fill in where it wasn't as dense. And so we still have a way to combat that.
Yeah.
And I think it's just most important to assess each patient and not try to go into it with a bias one way or the other. And, the funny thing is myself and some of my other colleagues are becoming the ones that are really being sought after more because there are fewer and fewer surgeons that know how to do an FUT properly. So it's actually created a greater need within our practice because there aren't now a lot of, physicians that still will do an FUT. Yeah. Many of them don't even know how. So it really limits, what can be done surgically with a patient, and it's just a shame.
Yeah, I just want to put just a little bit more emphasis on what Dr. McGrath was saying earlier about the donor hair, because this is something to be very aware of, but it's a little bit confusing, I think, to your average patient. So Dr. McGrath said that someone who comes in that has very good donor hair, so it means this area right there, it's really good, but on the bottom and on the top of that, on that sort of, best little strip in the back, that's always usually, the strongest hair, that the hair above that and below that is not super strong. Mm-hmm. So, sometimes people will regress with their hair loss, both upwards and downwards. Yes. And so the thing about FUT is when you take that strip, that is all from the best part of the donor hair. That is the strongest, thickest. It's got the best chance of surviving, and it's going to look the best on the top of the head. And all of the hair, 100% that's going on the top of your head, is from that best area. The problem with FUE is you can't just take a punch out all in that area, because then it's going to look even way worse than a strip. So you have to punch from sort of the whole back of the head. And if the back of your head above and below, that really, nice little strip of beautiful donor hair is kind of weak and fine and thin and even might fall out, well, then it's going to lead to a bad result for you. Sure. So it's that quality of donor hair is a little bit more specifically, what he's talking about. So those are some of the things to think about. I hope this is a helpful video. Thanks for coming on.
My pleasure as always, guys.